artificial intelligence in healthcare, the possibilities and whose jobs could be at risk.
Play that song again.
What's good, you guys? It's NWA here, Nurse Pat. Today we dropping some heat, some artificial heat. AI has come, whether we like it or not, and it's here to stay. And you probably know this, unless you've been living under a rock. And it's likely to keep evolving. In this video, I'm going to talk about the implications and possibilities that AI could give us in terms of healthcare, as well as, in my opinion, what jobs in healthcare might be at risk and be on the chopping block. The thought of AI could be scary to some. Think about those movies like iRobot or Ultron and the Avengers. Personally, I think we should just, try to implement it in our lives as smoothly as possible and coexist. Like I said, AI is already here, and it's even in healthcare. I went to the ENA Emergency Nurse Conference recently in San Diego, and they even had this AI triage implementation that they've already started in some hospitals. They're talking to us about how basically it's an AI triage helper in which the triage nurse will, implement the, chief complaint, document vital signs, etc. And then the AI called Kate will, review all of that, as well as if the patient's been there before or has other like chart review stuff. It could read all the chart review, all the history of the patient, to give an accurate representation and give suggestions for the triage nurse what to assign this patient for an ESI acuity level. This is pretty much used in emergency departments only. So it has the ability to access the patient's chart and quickly review things like that. One of our ER docs is actually helping out with the research and development of this specific AI product. So what are some possibilities that I could see, maybe even in the near future, with AI? I would say for sure faster diagnoses. AI would be able to help have faster and more efficient imaging readings, lab result readings, and just being able to put the pieces of the puzzle together a little bit quicker. And this is essentially what an emergency department does, right? An ER doctor and the nurses and everybody, one of the main things we do is we want to figure out what the heck is going on with the patient. In order to do so, the first steps we have to do is gather the chief complaint data, vital signs, patient presentation, assessments, and of course we need all that information via imaging, your x-rays, CT scans, MRIs, and then your lab results, all the blood work, all of that stuff, and that gives us an idea of what's truly going on with the patient. A second thing I would say is that AI might have some positive effects on predicting patient outcomes. So this would be for patients that are already admitted to the hospital. It could gather all the data in the patient's chart, your vital signs, lab results, all that stuff, as well as figure out trends from the patient from each day, different time frames, and sort of possibly give a projection score of a patient outcome. Now, possible implications, I'd say, in the public, outside of the hospital setting, sometimes I think about Jarvis with Iron Man.
Jarvis, scan this guy's balls.
Will do, sir. Scanning complete, sir.
Having an AI that would be able to tell you certain health indicators with yourself and vital signs, all that. I mean, we already have some things that monitor us that we use technology-wise. For instance, you have diabetes, blood sugar checkers, and blood sugar sensors that can alert your phones and all that. And then you have things for cardiac, like Zeo patches or Holter monitors that could, tell your patients and the providers if they're having like specific dysrhythmias and all that. Like people's Apple Watches could show your heart rate, your O2 sat, and a 1-lead ECG. I mean, it's not exactly super accurate, but it is a step further into being able to have AI in there, because your Apple Watch, when it senses these things, it notifies you, right? It'll notify your phone, it'll notify your watch. This is in sense an AI already. Now, talking to my coworker, he had a interesting idea in which AI could take into the future, and I feel like this would be a little bit way more into the future. You might have little boots, like walk-in boots in the streets, and they would basically be walk-in boots AI doctors. Imagine being able to access this. You walk in, give your chief complaint, let the machine take your vital signs. Somehow, if they could have the machine be able to take your blood draw, as well as do certain assessments like listen to your lungs or your heart. So auscultating the lungs, heart, and your stomach, and sort of comparing those sounds with the databases of different things. It could gather assessments. It could take pictures. And then, you know, if you needed any specific imaging, they might have you refer you to go to the hospital, or if there's anything else that's dangerous, it might just tell you to go to the hospital, or have some emergency transport come get you or something. I don't know. The other route it would take is if everything's all fine and you don't need to go to hospital, perhaps it could give you suggestions for discharge, as well as even write prescriptions. Who knows? That's a lot of further thinking, in which I don't think would happen anytime soon. But you never know. Now, which jobs do I think might be at risk? Radiologists might be at risk. So when radiologists read stuff, whether it be your x-rays, CT scans, MRIs, it takes a while, right? I mean, I'm sure if you had one before, or if you work at a hospital, you know that these things take a very long time.
I'm waiting, old man.
Very long time to read. So if you could implement AI into the readings of these images, and the AI will basically compare those images rapidly with the database of all other images, right? Like if it sees a lesion suspicious for cancer in your liver, and it'll compare that with other lesions in other people, then it could, it could definitely speed things up, in which that would put a radiologist's job at risk. One of the things in the ER, common complaints from patients, is how long results take for a CT scan and an MRI. And some of the cases, something might be acutely happening to the patient, and we don't have results yet. It's like, it sucks. It's a delay of care.
I'm in danger!
So AI might have some role in that. Other jobs at risk, I would say, could be your pharmacists and pharm techs. AI would be able to help with rapidly reviewing medications ordered by doctors, rapidly reviewing any possible side effects, any risk, any discrepancies regarding ordering the medication and the patient's past allergy history, seeing if one medication might not mix well with the other. Another role I could think of would maybe be case manager nurses. If you think about it, it's a possibility that AI could be able to, gather information and contact different areas, because a lot of things with case management is like placement issues. So it could rapidly search which, skilled nursing facilities or boarding cares, stuff like that, that have availability. It could contact them themselves, and it would know basically where the patient may or may not be able to get discharged to. It would be able to, check the insurance capabilities, the financial capabilities, stuff like that, as well as identifying which DME or medical equipment the patient might be having to discharge with. So in my opinion, this is something that I see possibly could be affecting case managers. Now, who's unlikely to get replaced? In my opinion, these are the healthcare roles that need physical interactions in order to do their job, or would benefit highly from personal encounters psychosocially. The personal interaction portion. Your regular nurses, your CNAs, your phlebotomist, your respiratory therapist, your regular mental health therapist or psychiatrist, social workers. These are things that I feel like are very difficult to replace with AI or a robot. Can you imagine a robot trying to be personable and make a person feel better with these things? No. Are you having thoughts of harming yourself or others? How is your sexual life? There. It's okay. Mama knows child. Stupid. There's just a lack of compassion, right? But yeah, I could be wrong about all these things. I have no crystal ball. These are just my opinions and what I think, just thinking about it. I didn't do any research or anything like that. This is just my thoughts. And I think the topic is very interesting. What are your thoughts on AI in healthcare? Leave a comment below. Be sure to like and subscribe to support your boy if you haven't already. Thanks for watching this video, And as always, stay safe, stay humble. I'm out.